Listener-supported St. Gabriel Catholic Radio AM 820 brings you Family Sanctuary, a show that inspires living the gospel message in word and deed within our families. And now, Family Sanctuary with host Peggy Hartshorn.
Welcome to Family Sanctuary, focusing on life-giving relationships and the family. I'm your host, Peggy Hartshorn, chairman of Heartbeat International, that advances life-affirming pregnancy help around the globe. And we're focusing now on the Family Sanctuary on a series of programs on issues surrounding the dignity of the person, especially on abortion. With the fall of Roe v. Wade in the Dobbs Supreme Court decision recently, abortion is again front and center, and there are efforts in almost every state, including ours, to make abortion a right in our state constitution. So now is the time to understand the truth about abortion, both the science and what our church teaches, because there's so many lies that you will be hearing, and I'm sure you already have, in the media, online, even perhaps from friends and family. Now's the time to learn and share the truth. So today, our program is on the topic of whether ectopic pregnancy or miscarriage treatment is an abortion. And actually, we've heard this accusation, this lie, in the media recently that if abortion is restricted in any way, women will not be able to be treated for ectopic pregnancy or miscarriage because that would be considered an abortion. So with us today to dispel that lie and to tell us the truth about medical treatment for ectopic pregnancy and miscarriage, we have a very distinguished physician, Dr. Christina Francis. Welcome, Christina.
Thank you so much for having me, Peggy.
You're so welcome, and thank you for being my guest. I want to give Dr. Francis a good introduction here. She's a board-certified OBGYN. She currently works in Fort Wayne, Indiana, as an OBGYN hospitalist. She completed medical school at Indiana University in 2005, did her residency at St. Vincent Hospital in Indianapolis, and she is now the CEO of the American Association of Pro-Life Obstetrics and Gynecologists. She's an associate scholar with the Charlotte Lozier Institute and a board member of Indiana Right to Life, and a physician member of the Abortion Pill Reversal Network, which is part of Heartbeat International. So I'm thrilled that you're part of that network, Christina. Christina has always had a passion for human rights, spending a significant portion of her life in various countries, working tirelessly on behalf of women and children. I understand you spent 3 years as an OBGYN in a mission hospital in rural Kenya. And so you really understand what true reproductive health is for women. Christina has written extensively on issues surrounding women's health and abortion, and her work has been published in the Wall Street Journal, Newsweek, and USA Today, and of course also in many of the resources that are on the wonderful website of APLOG, AAPLOG.org, which we'll be talking about some of the resources you provide, I know, as you speak with us, Christina. So thank you, and welcome again to our program. And it's just wonderful how much expertise you bring to this, along with your colleagues, of course, at APLOG.
Oh, well, thank you so much, Peggy. Again, it's such a pleasure to be here. And those of us at APLOG are so thankful for Heartbeat and all of the amazing work that you all are doing, especially through so many things. Actually, I was at your conference recently, and there's so many things that you all are doing that I wasn't even aware of, actually. And so it's wonderful to see that, but also just so wonderful to partner with you all on abortion pill reversal, and very exciting to be a part of that.
And of course, all the wonderful pro-life doctors, obstetrics and gynecologists who are part of our network as medical directors of pregnancy centers. And it's just a wonderful collaboration. So, tell us about this. It must frustrate. It would me if I were an OBGYN for sure. This idea that abortion is healthcare for women. It just is a disgusting concept. It doesn't make any sense to me.
Yeah, no, you're right. It is very frustrating. And just to give, for any of your listeners who maybe aren't familiar with who we are as an organization, I think it'll be good to sort of give some background of where we're approaching this issue from. we are a professional medical organization. We're not a religious organization, although many of our members are people of faith. But we exist to equip our members and the public and pregnancy care centers, such as those within the Heartbeat Network, with the medical evidence that supports the pro-life position. Because the bottom line is, the vast majority of the medical evidence actually shows that abortion is not healthcare. Induced abortion, which has the sole intent, and this is going to be important, I think, for our discussion today, induced abortion that has the sole intent of ending the life of my fetal patient, actually has no place in healthcare. It's damaging for women. It's certainly damaging for our fetal patients. And the medical evidence bears out that there's no health benefits to it for our patients. And so that's the sort of background of where we're coming from. We came out of the American College of OBGYNs, as we started as a special interest group there 50 years ago, and then became our own organization in 2013, and now represent approximately 7,000 members and growing every day. And because I think, more and more people within the medical profession are realizing the damage that elective induced abortion has done to our patients. And so it has, for us, been very frustrating, as you said, starting actually the day the Dobbs decision came out, to hear this false narrative, some of which might be intentional, some of which I think is just being born out of confusion and fear. After living under the tyranny of Roe for 50 years, most people that are in medical practice right now have never practiced outside of that framework. And so, so starting to hear that drumbeat that you're referring to, of now, if states are able to regulate abortion in any way, now women are not going to be able to receive the care that they need for things like miscarriage or ectopic pregnancy, when nothing could be further from the truth. And we know that for a couple of reasons. We know that because pre-Roe, when abortion was illegal in most states, actually, women were able to be treated for miscarriages. They were able to be treated for ectopic pregnancy. But we also know that there's not a single state law in this country right now that prohibits the treatment of either one of these conditions. In fact, oftentimes they're clearly excluded. There's clear language in the law that says this law does not apply in the circumstance of a miscarriage or an ectopic pregnancy. And the reason that's the case is because, again, going back to that intent piece, the sole intent of an abortion, of an induced abortion, is to end the life of that preborn human being. That's not our intent when we're treating an ectopic pregnancy. And that doesn't even apply when we're talking about miscarriage, because miscarriage, by definition, is where that fetal human being, that preborn human being, has already lost his or her life from natural causes. And so, this equivocation of these two very different things is really egregious in my viewpoint, especially coming from within the medical community.
Mm-hmm. You can understand why ordinary people who don't know much about medicine might be confused, but the medical profession certainly knows the difference.
Right. Absolutely.
So, that
Absolutely.
is so frustrating.
Yeah.
I loved what you said, Christina, the first time you made the point of the sole intent of abortion. You said the sole intent of abortion is ending the life, you said, of one of my patients. Because, of course, you have two patients.
It's one of the reasons why I chose the field of OBGYN, is because of the unique challenge that we have as physicians in caring for two patients at once. Mm-hmm. And it does present unique challenges. They're not insurmountable, but it does present unique challenges. In fact, I often say that, it's funny when working in a hospital, when you have a pregnant woman who comes in maybe with a condition not even related to her pregnancy. So you need to bring in other specialists to help in her care. And they don't want to be the admitting physician for her because they're concerned because there's another patient that we're dealing with. So, every specialty, not just ours, recognizes that when a woman is pregnant, we're talking about two distinct human beings. And that's why they want us as OBGYNs on board with her care, because we know how to take care of both of them, So we'll come on board to help take care of baby, and they'll take care of the issue that's going on with mom. And so this is, when we're not specifically focused on the topic of abortion, I think everyone within medicine actually recognizes that we've got two distinct patients here.
Mm.
But for some reason, when we had talk about abortion, those sort of ideological ideas, that may be repeating myself, but take over, I think, common sense. And so, and then it's like all that we know about medicine seems to go out the window, and we just focus on, not we, but, those who are promoting abortion just focus on this sort of quote unquote right to abortion, and everything we know about medicine then goes out the window.
Sure.
But again, I think if people are being honest, physicians and other medical professionals, they recognize that we're taking care of two distinct human beings here.
And I think that point, as you mentioned, is especially important with the subject of ectopic pregnancy, because I've been researching also this subject. My mother had an ectopic pregnancy before I was born, and they had to do life-saving work on her. She was a nurse during World War II. She was nursing in the hospital, and she just actually passed out, and they put her in a bed in a room. They were all so busy, they didn't have time to take care of her for a while. And she almost died from bleeding because they didn't realize she had an ectopic pregnancy. So I know from personal experience, again, the story of my family, that when abortion was totally illegal in every state of the Union back at the time of World War II, people were treated for ectopic pregnancy, and often, as your material says on your APLOG site, which I love the research that's available there, aaplog.org. In the case of ectopic pregnancy, there are clearly two patients there, the embryo and the mother. And in many cases, the embryo has already passed away once we know that a woman has an ectopic pregnancy. So could you talk some more about the two patients in the treatment of ectopic pregnancy, and what an ectopic pregnancy actually really is and how it is treated?
Yeah, so ectopic pregnancy is a fairly common condition. Actually, it occurs in about 1 in 50 pregnancies. And it's a condition where the embryo implants somewhere where it's not supposed to. So somewhere outside of the cavity of the mother's uterus. Most commonly, this is in the fallopian tube, although it can occur in other places, but the vast majority occur in the fallopian tube. And the reason that this is dangerous for the mother is because really the only organ in a woman's body that is designed to grow and expand with a growing baby, a growing pregnancy, is the uterus. And so when that embryo implants in, let's say, the fallopian tube, the fallopian tube can accommodate that for a certain period of time. But as that embryo continues to grow, it outgrows the capacity of the tube to expand. And so then what happens is that the tube can rupture. And then because of just the normal blood flow that's going to the fallopian tube, but also the increased blood flow that's going to help nourish that developing baby, then that can cause life-threatening hemorrhage into a woman's abdomen. And so
Christina, excuse me, I need to interrupt you just for a minute to reintroduce you, actually, because we're about halfway through our program, and I like for those who have just joined us to know that the expert speaking to us today about ectopic pregnancy and also miscarriage, and if that is related to abortion, is Dr. Christina Francis, a board-certified OBGYN who's currently in Fort Wayne, Indiana as an OBGYN hospitalist, and she is the CEO of APLOG, the American Association of Pro-Life OBGYNs. Okay, Christina, you've been explaining a little bit what happens when the embryo starts developing in the fallopian tube, and the tube bursts, which is, of course, as the embryo grows and develops, there's not room in the tube. The embryo is supposed to be in the uterus, and so that is life-threatening. The bleeding, the blood that is going there to nourish the embryo and regular blood flow combined leads to a life-threatening situation for the mother.
Yeah, absolutely. And so it still is one of the leading causes of maternal mortality in the first trimester, even here in the US, where we have, for the most part, pretty good access to emergency care. And so this is again not an uncommon condition that women face. And so this equivocation, though, of the treatment of this, which has to be treated in order to save the woman's life. When we're faced with a situation where either we can lose both lives, both mom and baby, or we can save one. Obviously, as people who are pro-life, we want to save all the lives that we can. And so that means we intervene. If we could save both of them in this situation, we absolutely would do that. Unfortunately, our medical technology is not to the point where that's possible. And so the person that we can save in this scenario is the mother. And so we do need to intervene in order to either prevent that life-threatening bleeding from occurring or to stop it when it's already in process. And so, there's a few different ways we do that. We can do that surgically, where you either remove the entire tube or you open the tube and remove the pregnancy, or it can be treated with a medication called methotrexate are the options that are available for treatment. But I think it's important to note that what is our intent when we're doing any of these options in treating ectopic pregnancy? Our intent is to save the life of the mother. Our intent is not to end the life of that preborn child. And so that's what differentiates this from an induced abortion, where our only intent is to end the life of that preborn child. In fact, we know that because how do we classify a failed abortion? It's a failed abortion when that child survives the process. So that, that tells us what the intent of the abortion process is. Again, if at some point our medical technology ever advances to the point where we can save that child's life in an ectopic pregnancy situation, then absolutely, that's what we would do as pro-life physicians. Mm-hmm. But I think it's also important to remember that another reason why it's ridiculous to compare this to an induced abortion, which is intervening in a healthy pregnancy to end the life of that child, is in the vast majority of cases, by the time we make the diagnosis of an ectopic pregnancy, it's something like 93% of cases, that preborn child will have already passed away, actually. And so most times, we're not even dealing with a child who's alive. And so in that way, it becomes very much like miscarriage treatment. But even in those cases, and I think this is an important distinction to make, even in those cases where that child is living, unfortunately, again, we still do have to intervene. The unintended consequence of that is that child will lose his or her life, but we know that child would lose his or her life regardless, even if we didn't intervene. And then in that situation, we would very likely be looking at losing mom's life as well. Mm-hmm. And so this has always been understood. I know I'm not Catholic, but I have lots of friends who are. And I know even within Catholic teaching, this has always been understood that we intervene to do the least harm and do the most good, mm-hmm. save who we can and do it in a way that respects the dignity of both of our patients. And that's what's being done when we intervene in treating ectopic pregnancies. And again, I think it's important to note, this is not prevented by a single state law currently on the books or any that I'm aware of being proposed anywhere in the U.S. With regards to abortion.
And nor has it ever been, even when abortion was illegal in every state. So, well, thank you, Christina. That was a very clear explanation. And I believe in Catholic ethical teaching, that's called the principle of double effect, mm-hmm. that a positive action may have an unintended and unavoidable consequence, negative consequence that is never intended, and that is the teaching in Catholic morality. So thank you very much for that clear explanation. And how also, because we're facing this accusation that limiting the right to abortion, so-called right to abortion, or limiting abortion would also prohibit physicians from treating miscarriage. And as you pointed out earlier, it's even more of a stretch here, because in the case of a miscarriage, the fetus, the embryo, the unborn child already has died. And mm-hmm. so we're not intervening at all to save the life or to we're not. It's a totally different situation than going in with the intent, as you say, the sole intent of ending the life is actually how we define abortion. So how does this accusation even come up that somehow abortion would prevent us from treating miscarriages?
Yeah, well, and this is, I think this is very damaging that this equivocation is being made out there in the media and from pro-abortion voices, because not only is it false, which we're going to talk about, but it's also very damaging to women who are going through something like a miscarriage. For them to be made to feel that they somehow are having an abortion performed when they're being treated for their miscarriage. And I actually saw the damage that this could do even before the Dobbs decision. So I think where some of the confusion comes up is that the medical term abortion for about 100 years has been applied to the ending of a pregnancy by any cause prior to 20 weeks. So a miscarriage in the medical diagnosis codes is referred to as a spontaneous abortion, meaning the pregnancy ended prior to 20 weeks, but spontaneously. So through no action by anyone, it just happened naturally on its own. And, I had patients who would go home from the hospital with their discharge paperwork after being treated for a miscarriage, and they saw this term there, and they would call very upset and ask me, is that what happened? Did I have an abortion? And I would explain to them, no, in no way was this the same thing. So I say that just to say that when this narrative is going on out there, it's actually very damaging to women as well, because it's causing confusion and hurt there that doesn't need to be there, on top of the trauma of the loss of their child that they're already going through.
Yes, Christina, I've heard this from women in the pregnancy center arena as well, where they've come home after a miscarriage and has seen that medical code, spontaneous abortion, and been very, very upset. You're so right on that.
Yeah, and I do actually think that it's something that needs to be changed within our diagnosis codes within medicine because of that, because of the harm I think that it has caused patients. And that's definitely very possible. I think it would take years for that to happen, but I think it's worthwhile to work towards. But even that being said, it has, again, been long understood within the practice of medicine that these are not the same thing. And in fact, when we talk to our patients, we use the word miscarriage because we understand that one, that's what we're talking about, but two, that's much more acceptable for patients to understand that this is not the same thing as an abortion. And so I think that's one cause of confusion, are those diagnosis codes. But the other is that sometimes we will use similar procedures to treat a miscarriage as we would to do an induced abortion. But that doesn't mean that they're the same thing. So for instance, oftentimes a first trimester miscarriage could be treated using a surgical procedure called a DNC, or a dilation and curettage. That same procedure could be used to dismember a living fetal human being for a first trimester induced abortion. But they are not at all the same thing. And a DNC for a miscarriage is not outlawed in states that have decided to regulate abortion in the first trimester. And, I thought through this a lot because, again, a lot of this came up really intensely after the Dobbs decision, and just very frustrating to me. And I was thinking through, are there other things in medicine that we do that intent really matters? Absolutely. So, one of the parts of my job is that I do C-sections when they're needed. When I use, I'll try not to get too graphic because I know not everybody listening to this is medical, but when I use a scalpel to make an incision on a woman's abdomen to do a C-section, my intent is either to help her or her baby or both. However, if I did that exact same thing with the intent to harm either one of them, it would be completely wrong, and everybody would recognize that. So I could use the exact same surgical techniques, but with different intent, and it would completely change whether or not that was something morally acceptable and ethically acceptable within medicine, and morally wrong or ethically wrong within medicine. And so intent actually plays very much into what we do as physicians all the time, and we recognize that and understand that. And so I think that's where it's really important to clear this up, that yes, some of the procedures like a DNC or certain medications that we might use to treat a miscarriage can also be used to induce an abortion with the intent of ending that fetal human being's life. But it's the intent piece that makes it right or wrong. And it's the intent piece that makes it either legal or illegal in states that have decided to regulate abortion.
And Christina, it's also, as you mentioned, the end or the object of the act itself. Is the child already deceased when this action takes place, or is the child living? and are you killing a living human being, or are you saving one of your patients? So it is the intent, yes, but it also is important that the actual outcome or end of the action is very different.
Mm-hmm.
Yeah,
absolutely. Yeah. And you're right. Saying that dismembering a living human being who sometimes, depending on how far along you are in the pregnancy, is capable of feeling exquisite pain in that procedure is the same thing as removing a human being who has already passed away. Trying to equivocate those two things is ludicrous to me. And I think if anybody steps back and really honestly thinks about it, they would recognize that it's not at all the same thing.
Absolutely.
And so, yeah.
Well,
yeah.
thank you.
And again, help making women, especially families who are going through the tragic loss of a child, feel that it is the same thing is very emotionally damaging, and it's emotionally manipulative, because I think that oftentimes is being used to get people to support very permissive laws on abortion,
Absolutely.
simply out of the fear that they may not be able to receive life-saving care when they need to.
Such a good point. Well, Dr. Francis, unfortunately, we are out of time. You've just given us so much to think about and so much important information. Thank you so much for being our guest today. And for our listeners, this program, of course, will be in our podcasts. I want to refer again to the website aplog, AAPLOG.com. Also, if anybody listening to the program has had an abortion or miscarriage, needs support, please call optionline.org, 1-800-712-HELP, or 4357, 1-800-712-4357, or check pregnancycenters.org. There is help and support available. And you're listening today to the Family Sanctuary on stgabrielradio.com. We're broadcast at 4 o'clock on Sundays and at 4 o'clock on Saturdays and 2 o'clock on Sundays. So please join us again to strengthen our families and make them sanctuaries of life as God intends.
Family Sanctuary is a production of listener-supported St. Gabriel Catholic Radio, AM 820. Archives of Family Sanctuary with Peggy Hartshorn are available at stgabrielradio.com.